This wasn't just about accessing U.S. government funds. It was about an opportunity. And to succeed at it, you really had to know the terrain and what you were about. We were bringing them a new idea that was a complicated, sensitive idea. Remembering that our program had two tracks. We worked at the community level where we mobilized traditional leaders to organize men to come to these community information centers. And we worked at the clinic level where we worked with pregnant women to invite their male partner in for couple counseling and then education. Seeing that so much of our success was due to Dr. Sinkala's entree. I think what helped us is Moses's being Zambian, having worked at the ministry, having done his time in the trenches, he was able to see what their concerns were before they became concerns, if you will, and kind of preempted any doubt or intimidation or some of the things that often happen when you come in with a new program.
Nazarene Compassionate Ministries is it's a faith-based organization working with the Church of the Nazarene in Zambia. We are fully involved in four main areas of community development, health, that involves HIV and AIDS. Also, we are involved in education, where we do provide education to orphans.
I feel like our setup was, we had all of our partners from the beginning. It was almost like a consortium, even though we were the prime. We treated them as almost equal participants and not just as, we're just contracting with you and you're always on, it's year to year and it's based on performance. And it was kind of more of a commitment that we're all sharing this together.
In CMMB, we created joint ownership by creating an atmosphere of equality with the key stakeholders who were the church health institutions and the traditional community leaders. During the training sessions of training community leaders as champions of HIV prevention, we respected each other in identifying solutions that impede men to participate in PMTCT and HIV testing and counseling.
In NCM Zambia, we created joint ownership by implementing the home-based care programs and also the prevention program through the church. So we engaged the church from inception. We mobilized the church. We explained everything that was expected of the church. And initially, as we implemented this program, the church was already doing something.
And during this program, the greatest benefit is that the rate of children who are exposed to getting infected has reduced because of the mothers and their husbands have got involved in the care of this exposed child.
CMMB engaged the church health institution and the traditional community leaders using a participatory learning methodology for action for prevention of HIV transmission. This involved identifying the common goal of preventing new HIV infections and aligning our values to the values of the beneficiaries, including values such as individual community capacity building, integrity, social justice, compassion, in addressing social cultural behaviors that drive the HIV epidemic, and also to improve the care for patients or clients already living with HIV.
So I'm not sure that the word partnership really applies to the way we saw these relationships, nor to the way they saw it. I think we became partners through the 3 years with the common objective.
NCM Zambia goal or values is to mobilize the local church to be fully involved as it implements its HIV/AIDS programs. Through NPI, we were able to achieve the goal by helping the church, by building the capacity for the church to implement the home-based care programs.
So some of these shifts, it was very difficult to convince them. There were some who had lost their relatives, including daughters and sons, and for them to convince them on human rights, that HIV people also have got the right to live, to have children, and to marry. It was difficult. The CHIs took us to the chiefs to introduce, because we said this is a community program, and I think we want the chiefs to be actively involved. And there are certain procedures which you have to follow traditionally when you are going to the chief. Sometimes you may have to walk kneeling from here to there. I never thought I would kneel down so much and walk on the knees like that.
There are some areas which are hard to reach where we went, such that the community had the information. They were given the information, and at least they became aware of MTA, what is involved in men taking action, their role.
In the culture that we have, we are in men, it's unethical for a man to go to a health center to take a leading role in having maybe encouraging a woman or a family maybe to get tested or maybe for any other health service. And we've seen a positive change. Like I just saw 2 men coming with babies on their back. Yeah. So I said, what is this now? I said, no, because it's the MTA program, so they're able now to understand the benefit of health.
We must have created a feeling of solidarity in that group, that they were strong enough and courageous enough to just follow up and be tested.
As partners, we shared our expectations with the beneficiaries and the key stakeholders, that activities for mobilizing communities and engaging them meaningfully, so that the barriers to male involvement in PMTCT and HIV testing and counseling are removed, and these activities continue after the end of NPI.
We shared our expectations by ensuring that there is a proper understanding what we were supposed to do, understanding what was in the proposal. We shared so that everyone we could manage our programs and we'd move together. So we really did that by working with the church leadership from the top up to the bottom, and ensuring that they all understood what was expected of us to do.
We held regular commitment meetings with the church health institution and the district health offices associated with this institution to encourage them to add these activities in the annual action plans and budgets, that has ensured that these activities have continued even when NPI came to an end.
We ensured that all the key players, like the volunteers who are implementing these programs, understood their role, understood the expectations of the programs.
First and foremost, effective partnership require effective, appropriate communication that is meaningful, routine, and focused on assessing program performance, on how improvement can be made. So what we used to do on a very regular basis, which became very, very routine, was holding meetings with the various key stakeholders, particularly the church health institutions and the district health offices, to evaluate program performance, identify best practices that can be scaled up, and also work out solutions to address the challenges.
NPI, it came with a bang, and it came with a lot of pressure. Yeah. But at the end of it all, it was a very good learning ground. Thank God it has been done, and thank God I was part and parcel of it.